Good morning, everyone. So today we are going to discuss a topic called hypersensitivity. So what do you mean by hypersensitivity, and what are the different types of hypersensitivity reactions are there, and what was the mechanism behind these hypersensitivity reactions, and what are the examples of hypersensitivity reactions of different types of hypersensitivity reactions. So these are the things that we are going to discuss in today's class. Okay. So before going to that, first we have to know what was the definition of that hypersensitivity. So generally it is defined as an exaggerated or inappropriate state of normal immune response with onset of adverse effects on the body. That means like exaggeration of the immune response, like it's not like whatever it is required that much is not produced. Exaggeration or inappropriate state of immune response is considered as hypersensitivity reactions. Hyper means more, exaggerated sensitivity, so more sensitivity is seen, so that condition is called as hypersensitivity reactions. So when there is exaggeration or inappropriate state of this response, it will cause some kind of adverse effects in the body, so that we are going to study now. And during this hypersensitivity reaction, whatever the lesions that are formed, that we call it as antigen antibody reaction. So that is called as antigen antibody reactions. And so these lesions are termed as hypersensitivity reactions or immunological tissue injury. So what is that? Hypersensitivity is nothing but exaggeration or inappropriate immune response is considered as hypersensitivity, and it results in some kind of adverse effects in the body. And then depending upon the rapidity of this reaction and the type of this response, these were classified into two types, that is immediate type and delayed type. If the response is immediate, then we call it as immediate type, and that means rapid is, it is very rapid, so that we call it as immediate type. Delayed type is even after the exposure to some kind of antigen, if the response takes a longer duration, then we call it as delayed type of hypersensitivity reaction. Okay. Again, these were further classified into four different types depending on their mechanism and depending on their other factors, mechanism, etiology, and all these. Considering these factors, these were again classified into four different types. They are type 1 hypersensitivity reaction, type 2 hypersensitivity reaction, type 3 hypersensitivity reaction, and type 4 hypersensitivity reaction. So in this table, there is a differences between all these four different types of hypersensitivity reaction. So before going into this table, first we have to know in detail each and every type of hypersensitivity reactions. Okay. So type 1 hypersensitivity reaction is also called as anaphylactic reaction. So what do you mean by anaphylactic reaction or atopic reaction? It is defined as a state of rapidly developing or anaphylactic immune response to an antigen or to an allergen. So like it's a response, exaggerated response to any antigen. So which causes anaphylactic symptoms. Anaphylactic symptoms that we call it as anaphylactic reactions. So here it is very rapid. That means that reaction appears within 15 to 30 minutes of exposure to antigen. Coming to etiology, like genetic basis, like if some people they will be like allergic to dust, some people will be allergic to pollen grains. So genetic basis, if your father is having this some food allergic to like if he's allergic to pollen grains, then you are at risk of getting this same kind of allergy, like at most 50% chances are there. So that is the reason it is called as genetic basis. So here also immunoglobulin E are produced, and then environmental pollutants. As I said that some people will be allergic to certain kind of pollutions like carbon smoking and all. So these, what is these environmental pollutants will do? They will increase the mucosal permeability. So when there is increased mucosal permeability, it will allow the increased entry of allergen into the body. So whatever the allergens are there, allergic substances are there, because of increased mucosal permeability, these there is more chance of this getting enter into body. So because of this more number of recruitment of these allergens, there will be increased production of immunoglobulin E. And then coming to concomitant factors, what does the word concomitant means? Concomitant is nothing but along with some kind of reaction, other reactions which will exaggerate the condition, that we call it as concomitant factors, that is parallel factors. Here simultaneous occurrence of any viral infection of upper respiratory tract in suspected individual. So any other, like along with this type 1 or type 2 reactions, type 1 reaction, there is some other viral infection, the upper respiratory tract infection, that also causes worsens this anaphylactic reactions. And then coming to pathogenesis, so first, what happens? First, contact of this antigen should be taken place. So immediately when this antigen comes in contact with the host cells, so first what will happen? Sensitization takes place. What do you mean by sensitization? That means identifying or recognizing that as an antigen. So in response to this contact with this antigen, what our body will do? It will release certain, whatever already in the blood circulation, there will be B lymphocytes and T lymphocytes. Whatever the circulating B lymphocytes are there, once this antigen comes in contact with this host cell, these B cells will get activated. Circulating B cells will get activated, and these B cells will be converted into plasmacytoid cells and then plasma cells. So these plasma cells will release immunoglobulin E. Okay, so IgE antibodies which are formed, that will bind to Fc receptor. What is Fc receptor? As I said, that it will be helpful in the binding of antigen to the B cells. Fc receptor is like this strand like thing is there which helps in binding. So these IgE antibodies which are formed, that will bind to these Fc receptors which are present on the surface of mast cells and basophils. So, which are the main effector cells of type 1 reaction? So, mast cells and basophils are the main cells of immune reaction in type 1 reaction. So, it will help in binding these both antigen and because of the binding to B lymphocytes, it will release IgE antibodies which are present on this cell surface of mast cells and basophils. So, this is the first step. Again, the second contact with the same antigen, what will happen? Whatever the IgE antibodies which are present on the mast cells and basophils, they will bind to Fc receptors. So when this binds to Fc component, Fc receptor, what will it do? It will cause a cell damage. So once it damages a cell, membrane will be damaged. That means lysis of the membrane will be taking place because of, and also influx of sodium and water degranulation of mast cells and basophils will be taken place. So then what will happen because of this damage of this membrane and all, whatever the contents are there, that will be comes out, like means that means there will be release of granules due to degranulation because of this water and influx of sodium. So next step is undergoes degranulation. So when it undergoes degranulation, it will release some contents. What are the things that we like that are released? Histamine, serotonin, vasoactive intestinal peptides, chemotactic factors, eosinophils, leukotrienes, prostaglandins, platelet activating factors. So all these which are present in the mast cells and basophils will be released. So these pro-inflammatory the pro-inflammatory mediators which have been released, that will cause a cell injury or tissue damage. So what are the kind of damages that can do is they will increase the vascular permeability, they cause smooth muscle contraction, they cause early vasoconstriction followed by vasodilation, and increased gastric secretion, increased nasal and lacrimal secretions, increased migration of eosinophils and neutrophils. So that causes eosinophilia and neutrophilia. That means there will be increase in the eosinophil count and neutrophils count. So this is the pathogenesis. Once again I'll repeat. So first contact, immediately when this antigen enters into the host cell, what will happen? It will be sensitized. The host cell will sensitize that, and so once it identifies, what will happen? Whatever the circulating B lymphocytes are there, that will get activated. So once they get activated, they will release immunoglobulin E antibodies by formation of plasmacytoid cells and plasma cells. So from these plasma cells, IgE antibodies will be released. So this is the first contact. Okay, so whatever these IgE antibodies are released, that with the help of Fc receptor, that will bind to the mast cells and basophils. So now our bodies, in our body, basophils and mast cells are ready with IgE antibodies. Okay, and now after the second contact, what will happen? Whatever the already formed IgE antibodies which were bound to basophils and or mast cells. So already in our circulating blood there is already presence of these, I mean, immunoglobulin E antibodies. So whatever the antigen comes, These IgE antibodies which are already prepared in our body will go and bind to that and cause a cell injury. Okay, and will cause the cell damage. So once there is cell damage, it will cause membrane damage also. So once the membrane is damaged, it causes influx of sodium and water into these cells, causing the degranulation. So once the cell is damaged, it will release all its contents into the circulation. So what does it contain? Like pro-inflammatory cells. So these pro-inflammatory cells will cause these actions like increased vascular permeability, smooth muscle contraction. So all these are the things that will be taking place. Okay. And then coming to examples. So there are two types of examples, that is systemic anaphylactic reactions and local anaphylactic reactions. Systemic anaphylaxis can be seen when TT injection is given. Sometimes there is a risk of getting anti-tetanus serum and administration of drugs like penicillin. So when penicillin is given, some people will be penicillins like amoxicillin, ampicillin. So when these injections were given, patient will be showing some kind of reactions. So that also comes under systemic anaphylactic reaction. And sting by wasp or bee, like honeybee sting or any wasp, if there is an insect bite, at that time also we can see the systemic anaphylactic reactions. And then coming to local anaphylaxis, hay fever, that is seasonal allergic rhinitis, and also due to pollen sensitization. So, for conjunctive and nasal passages, bronchial asthma due to allergens, food allergy due to some foods like fish, cow's milk, eggs, snake gourd, and cutaneous anaphylaxis due to contact of antigen with skin, characterized by urticaria. Urticaria is nothing but itching, wheal, and flare. That means it's a warmth kind of sensation and also inflammation that can be seen on the skin. And angioedema means inflammation of this blood vessel. So and also edema of eyelids, lips, tongue and trunk, this can be seen. So these are the local anaphylactic reactions. This is the systemic anaphylactic reactions. Okay, this is all about type 1 hypersensitivity reactions or anaphylactic reactions. So now we'll be seeing this picture. So if you see this, so when this is antigen, so when this antigen first comes in contact with B cell, it undergoes sensitization. So once it undergoes sensitization, it forms a plasma cell. This plasma cell will release IgE antibodies. So these released IgE antibodies will bind to basophils or mast cells. So these IgE antibodies will bind to basophil and mast cells. So once it binds to this basophil and mast cell, it causes cell damage and causes the release of all the contents into the circulation. So this is all about the mechanism of type 1 hypersensitivity reaction. Okay. And then coming to type 2 hypersensitivity reactions. Type 2 hypersensitivity reactions are also called as cytotoxic reactions. So cytotoxic reactions are brought with what kind of cells? T lymphocytes. So what does they do? They will cause the directly damage of the cell. So this kind of reaction will be seen like within 15 to 30 minutes of exposure to antigen. Then coming to etiology and pathogenesis, it involves, so whatever the target cell or the foreign cell which is there, so it will be having antigen, right? So that will binds to FAB protein of the antibody, like antibody like IgG or IgM antibodies, which are present on our host cells. So now what will happen? This antigen which is having that antigen, like this foreign particle, the foreign cell which is having the antigen, it will binds with the help of FAB portion to the antibody, that is IgG or IgM antibody. So once this antigen binds to this antibody, it forms a complex, that is antigen antibody complex will be formed. And then the unattached Fc fragment of antibodies forms a link between antigen and the antigen complement. So it will forms a attachment between the antigen and the complement factor. So because of this formation of this link, it will cause the activation of some complement system. So when this complement system gets activated, it will release some complement components like C3b. So C3b is formed by splitting of C4 and C2 by C1. So these are the complement factors C3b, C4, C2, C1. So because of this uniting of this antigen antibody with this Fc fragment, it will causes the activation of complement system. So when this complement system gets activated, it will release certain complement components like C3b, C4, C2 and C1. So once the C3b is released, it gets activated. So once it gets activated, it bounds to the target cell, that is foreign cell, by forming a opsonin and attracts phagocytes to the site of cell injury. So it acts as an opsonin. That means it brought this phagocytosis will be done. That means it will engulf this foreign particle. And then antigen antibody complex also activates this complement system, and it will expose a membrane attacking complex, that is MAC, will be released that attacks and destroys the target cell. So this is how the mechanism will be seen. So first what will happen, whatever the antigen which is present on the target cell, it will attract and bind to FAB portion of this antibody. Which antibody? IgG, IgM, and forms a complex, that is antigen antibody complex will be formed. Okay. And then whatever the FC portion which is unattached is there, that will go and bind, and when this will find these will form a link. This binding will cause the activation of complement system and release of C3b. How this C3b is produced? By splitting of C4 and C2 by C1. So in this process C3b is released. So this C3b component, what will happen, it will act as an opsonin. That means it will engulf and it will attract this phagocytes and cause engulfment of this antigen antibody complex. Okay. And also when this antigen antibody complex is formed, it will release certain, it will activate membrane attack complex. So this is the other complement factor which is released during the formation of this complex. So this MAC, what does it will do? It will directly destroys this target cell. So this is how cytotoxic reaction takes place. And then coming to examples, it is of two types, that is cytotoxic antibodies to blood cells and cytotoxic antibodies to tissue components. So antibodies to blood cells and antibodies to tissue components. So antibodies to blood cells, in that examples include autoimmune hemolytic anemia. So generally what will happen, it identifies its own cells as a foreign particle and causes breakdown of these blood cells by forming antibodies. And then hemolytic disease of the newborn, it is also called as erythroblastosis betalis. So if you see in anatomy and physiology in the first year, you have clearly studied about that topic, so you can go through that. And idiopathic thrombocytopenic purpura, that means antibodies will be formed against this thrombocytopes, that means against platelets, causing their destruction, causing thrombocytopenia. And then leukopenia, here antibodies are produced against white blood cells, because of that there will be decrease in the white blood cell count. And drug induced cytotoxic antibodies are formed. So when using certain drugs like penicillin, methyl-dopa, rifampicin, for that when that drug undergoes metabolism, it will release certain metabolites. So these metabolites act as haptens. Haptens is nothing but they will not directly cause, or they will not directly involve in immune reactions. So once they combines with other antigen, any other antigen, it will be act as an it will cause immune reaction. So that will be seen, that is called as drug induced cytotoxic antibodies. And then coming to cytotoxic antibodies to tissue components, this can be seen in Graves' disease, myasthenia gravis, male sterility, type 1 diabetes mellitus, hyperacute rejection reactions. So these are the examples that we can see in when these antibodies are formed in tissue components. Okay. And then coming to type 3 immune complex, so once again we'll go to this flow chart. So when this antigen is there, this antigen gets identified. So in this again, what will happen, the B cells, whatever they will identify that and forms an FAB form of antibody. Antigens and antibodies will together forms a complex, that is antigen antibody complex will be formed. Here also B cells only are involved, not T cells, excuse me for that. And then causes complement activation. So this link of FC antigen and the complement. So this is the complement activation. So when this complement activation takes place, that is as I said that C3b and all. C3b and MEAC, they will cause the phagocytosis and damages this foreign particle. Then coming to type 3 reaction, it is also called as immune complex mediated reaction. That means what is immune complex? Antigen antibody is a complex that is formed. So once this antigen antibody complex is formed, it causes the activation of complement system and inflammatory reaction resulting in the cell injury. Here the onset of time is 6 hours after exposure to antigen, and etiology, it includes persistence of low grade microbial infection. That means it is a chronic kind of reaction. That means slowly, progressively, this reaction will be taking place, and extrinsic environmental antigen and autoimmune process. Here, the pathogenesis includes again the same, whatever the immune complex that are formed by reacting this antigen and antibody. So when this antigen antibody complex, if it has to be utilized, or it has to be cause that immune reaction immediately. Generally, in as we have seen in type 2, but in case of type 3, what will happen? Whatever the antigen antibody complex which is formed, that will not be completely removed from the body. A portion of it will be still remaining. So when that small portion of it is remaining in the body, when that small portion is deposited into the tissues, later on it causes the immune reaction. So whatever that is deposited into the tissues or body fluid, so again later on it causes the activation of FC component and release of certain complement factors like C3a, C5a and MAC, that is membrane attacking complex. So when these release, they will again cause a cytotoxicity. So immune complex mediated reaction. Okay, did you understand? It's similar to type 2 reaction, but what will happen when the type 2 reaction taken place, if it is not done completely, again if any small portion of this complex is still remaining in the tissues, that will again trigger the reaction. So that we call it as type 3 or immune complex mediated reaction. Okay, so this is how it causes. And the examples of it include immune complex glomerulonephritis, Goodpasture syndrome, SLE, that is systemic lupus erythematosus, rheumatoid arthritis. So these are the examples of type 3 reaction. And then type 4, that is delayed hypersensitivity reaction or cell mediated hypersensitivity reactions. So the name itself indicates delayed means it is very slow and prolonged response, but all above three are caused due to B cells. Here T lymphocytes are involved. So the reaction occurs about 24 hours after exposure to antigen, and it may last up to 14 days. And then coming to etiology and pathogenesis, in this reaction, mast cells, basophils, macrophages, CD8 plus T cells or T suppressor cells are involved. So first of all, whatever the antigen it is there, it is recognized by T suppressor cells or cytotoxic CD8 plus cells, and once they are exposed to that cytotoxic T cells, these were processed by antigen presenting cells. So whatever these antigen presenting cells are there, that will migrate to lymph nodes and then present it to helper T cells, that is CD4 plus cells. And then helper T cells, what will they do? So first, it will be identified by T suppressor CD8 plus cells, and when these were processed, that will be presented to T helper cells, and these helper T cells, they will release cytokines like interleukins and all. So whatever the cytokines that are released, that will stimulate T cell proliferation and activate macrophages. So again, there will be proliferation of T cells and activation of macrophages. So once these macrophages gets activated, they will release pro-inflammatory mediators and cause cell destruction. So this is the mechanism of type 4 or delayed hypersensitivity reaction. CD8 plus T cells, they will present the cell to antigen presenting cell. So this antigen presenting cell will take this to T helper cells. So once it reaches this T helper cells, they will cause a release of mast cells, which activates, which will cause a proliferation of T cells and activation. So once this is presented to mast cells, these mast cells these mast cells will release certain pro-inflammatory mediators, which causes the cell destruction. And then coming to the examples, this can be seen in case of mycobacterial infections like tuberculin reaction, granulomatous reaction in TB and leprosy, and virally infected cells, malignant cells, organ transplantation. So in these reactions, we can see in these cases, we can see this type 4 reaction. So is that clear? And now we'll check this table differences. So coming to type 1, it is also called as anaphylactic reaction. Type 2 is called as cytotoxic reaction. Type 3 is called as immune complex reaction. Type 4 is called delayed hypersensitivity. So type 1 is rapidly developing immune response in a previously sensitized person. As I said, that first sensitization and second, after second contact, we can see this reaction. And type 2, it includes humoral antibodies which will attack the cell surface antigens and cause cell lysis. In type 3, so whatever the antigen antibody complex which are deposited into the tissues, that will cause this. And type 4 is slow and prolonged response. And here the peak action time is 15 to 30 minutes, type 2 15 to 30 minutes. In type 3 it is 6 hours. In type 4 after 24 hours. So this is the delayed hypersensitivity reaction. And type 1 is mediated by IgE antibodies, type 2 IgG or IgM antibodies, type 3 IgG and IgM antibodies. So all these three processes will take place in the B lymphocytes. And type 4, it includes cell mediated. So here T cells are involved, T lymphocytes are involved. And then etiology, here the genetic base is pollutants and viral infections. In type 2, HLA linked exposure to foreign tissues or cells. Here the persistence of already existing antigen antibody complex. Here in type 4, cutaneous antigens will cause this, and CD8 plus T cells. And examples include, it includes systemic anaphylaxis and local anaphylaxis that we have already discussed clearly. In cytotoxic, we can see again cytotoxic antibodies to blood cells and cytotoxic antibodies to tissue components. And type 4 and type 3 like glomerulonephritis, SLE, and drug-induced vasculitis, so all this. And type 4, like it can be seen in TB, leprosy, and in tumors and virus in certain viral infections. So this is all about what are the different types of hypersensitivity reactions and their mechanisms and pathogenesis and examples. So if you have any other doubts, you can ask me. Thank you all for your